Lake Superior Life Care and Hospice provides compassionate medical care for those facing a life-limiting illness. Hospice services focus on helping patients and families live comfortably for as long as possible. Hospice is a team-oriented approach that includes professional medical, social, emotional, and spiritual support during this difficult time. This educational series will cover a variety of topics related to the various roles of the hospice interdisciplinary team. Hospice philosophy.
Hello, my name is Nicole Trejo, and I am the Clinical Director for Lake Superior Life Care and Hospice. So hospice is a different type of care, and it is offered for the individuals at the end of their life or with a diagnosis of a terminal condition. So hospice is a different type of care. There's two models of care where Medicare looks at hospice as the quality of life and the comfort model, where we focus on quality, making every day a good day, the best day it can be for each individual. Patients that are eligible for hospice would be anybody with a terminal diagnosis or typical prognosis of less than 6 months of life. Again, doesn't necessarily mean that they'll only be with us 6 months. It could be give or take, depending if a disease follows its normal course, the prognosis would be less than 6 months. However, we have patients for less, we have patients for a lot longer. We see or service a lot of patients with a variety of different diagnoses, including Alzheimer's, dementia, cancer diagnoses, heart failure, COPD, stroke. So lots of people, depending on their diagnosis, we service a lot of individuals. And also with hospice eligibility, it does not matter the age of the patient. We service people at all ages of life, whether it's from infancy all the way up to late or old adulthood. So for a referral for hospice can come from anybody. We can get referrals from the patient themselves, family members, friends, neighbors, primary care physicians we receive a lot from, hospitalists, assisted living staff, nursing home staff, etc. So a hospice referral can come from anybody, including the patient. So Lake Superior Life Care and Hospice provides hospice services wherever home is to the patient, whether it's in the home itself, assisted living, skilled nursing. If it's end of life in the hospital setting, we can coordinate with the hospital staff. So again, anywhere home is, we will go to you. So the hospice is a Medicare benefit. So what Medicare and hospice provide services for would be any medications related to comfort or the primary hospice diagnosis. We also would supply all needed equipment such as a hospital bed, oxygen, etc. that's needed throughout the patient's care, whether it's start of admission or as weeks or months go on. So we also hospice would provide services for durable medical equipment or equipment that they may need throughout their course of hospice, whether that be wheelchairs, walkers, oxygen, hospital bed, pressure relieving devices, whatever it may be at any time of their stay with hospice. Hospice is a Medicare covered benefit, so if you are over the age or have the eligibility of Medicare or currently under a Medicare plan, that would be considered a eligibility with hospice. So Medicare looks at, they're going to provide two types of care, either aggressive care or comfort care, and hospice would fall under that comfort care. We do have service individuals who are either private pay or have private insurance such as Blue Cross, TRICARE, etc. Most often those insurances do cover hospice. However, we will help coordinate to ensure that's covered or check eligibility and payment and so forth. With hospice, you would elect one primary physician that you will still coordinate care with. Most of our patients will elect to have their primary care provider, and Medicare will pay while you have hospice to see that individual that you elect to be your primary physician with hospice. So that's certainly a benefit that you can still see your primary care, and we also coordinate with that primary care doctor regarding medications, updates on patient conditions, questions, etc. However, you can elect a primary physician with hospice, whether it is the primary care, the oncologist, cardiologist, etc. You can have that option to select one specific individual who you will choose to see and be followed during your hospice stay. Our hospice team is made up of a variety of team members that will meet all the patients at any given time during their stay with us. We have our medical directors, 3 medical directors, and they help oversee our care that we provide to our hospice patients in addition to collaboration with the patient's primary physician. So they are available to us. We always have a primary medical director on call 7 days a week, and so we can call them for symptom management. So the hospice team approach, we have a variety of team members ranging from physicians, nurses, social work, home health aides, spiritual care, volunteers, etc., that all work together to ensure our patients are receiving the highest quality of care. And that way we're getting a team approach is the best approach, so that way we're seeing the patients at all different angles, treating them holistically to get that best service of care and quality of care. So my role as a clinical director at Lake Superior Life Care and Hospice is I oversee the nursing staff, spiritual care, and also our social work services. I help coordinate and collaborate with our community members, our family members, and work in a lot of outreach programs to spread the word about hospice and provide education. I also help assist with providing, we collaborate with Northern Michigan University to work with our Northern Michigan University student nurses to see what we do, and also help coordinate with our residents to also assist with providing hospice services. So my role at hospice and working with Lake Superior Life Care and Hospice is more than just a job. It's my passion. It's a way of life, and truly providing and being a part of the journey for hospice patients and providing that symptom control, comfort, and support just for our patients and family is beyond words can explain. A wish that I would have for the community to be aware of regarding hospice would be to coming into hospice sooner rather than later, and the stereotypes that go with hospice. Many times individuals hear hospice and they think they must be imminently dying or dying within the next week or 2 or days or so. However, the sooner hospice gets in, the more support and the better quality and comfort we're able to provide to our patients and our families. So our services at Lake Superior Hospice provide holistic care to the patient and their family members. When we are providing, so our biggest thing would be providing support to the family members, reassurance that they're doing the right things, taking care of their loved one, because we're now teaching them how to take care of their loved one at home at their final time of their life. So providing a lot of education, support, and sometimes just a listening ear, and just active listening to them, and again, just providing that big support for them goes a long way. So I had a patient experience. I got to meet the patient in the hospital. We talked about hospice services. This individual was going to be going home, and we knew it was only going to be days at this time. When we got home, the patient, his family member, had redone the whole house, was going above and beyond to ensure that they were able to take care of this patient regardless of the situation. When we walked in, she had arrived home via EMS. When we arrived in the home to do the admission, just the connection between the patient and her husband, it almost was like the universe stopped for a minute as she, got settled. Her husband went over to her, gave a big hug. The patient and the husband actually showed, just a sign of relief. I'm finally home. This was my dying wish, to die at home, and I have the right tools now and support for the patient and the husband. And this really reminded me of why I chose to work with hospice.